Hello and welcome to the PsyD webinar for Divine Mercy University. My name is Bradley Seifer and I'm the PsyD admissions advisor. And joining me is Matthew Nguyen. He is a third year doctoral student at Divine Mercy University. And so the format for, I met. So the format for our webinar today is we're going to go over a little bit of a slideshow presentation detailing the major aspects of the program. And then I'm going to hand it over to Matthew, and then he's going to talk a bit about his experience as a student at Divine Mercy, and his story, sort of how he got interested in psychology, and some of his career plans. And then after that, we'll go over some questions that you guys have. So feel free as we go through this to drop any and all questions in the chat box as we go through, and we'll field all the questions at the end. So as we go through, drop the questions in the chat, and then we'll attend to them at the end. And so without further ado, let's get started, and I'll share my screen. Okay, so this is the overview of the Doctor of Clinical Psychology at Divine Mercy University. This is me, Bradley, the admissions advisor. Okay, so Divine Mercy University is a Catholic institution comprised of two schools. It's dedicated to the scientific study of psychology with a Catholic Christian understanding of the person, marriage, and family. It was founded in 1999 as the Institute for the Psychological Sciences. And in 2014, the Institute launched its MS in Psychology program online with its focus on educating working professionals. In 2015, IPS was renamed Divine Mercy University with the addition of the School of Counseling. So as you can see, this is a diagram that just sort of shows you what I just mentioned, namely that we're a university, we have two schools, we have a School of Counseling and the Institute for the Psychological Sciences. The School of Counseling is chiefly online, though it's also hybrid in the sense that our counseling students come in for about a week toward the end of their training to come on campus for clinical work. And within the Institute for the Psychological Sciences, we have the doctoral program, which we're going to discuss today, and that is a residential program, and then the Masters of Psychology, which is exclusively online. All right. So our mission is to provide students with an effective academic and educational environment that supports the integration of the psychological sciences and the Catholic Christian understanding of the person, and to prepare students to respond to their vocation as mental health professionals. We are located in Sterling, Virginia, which is, as you might say, a suburb of Washington, D.C. We are well located in the sense that we have much to do to the west and to the east. To the west, we have mountains, we have vineyards, we have whitewater rafting, lots of hiking and outdoorsy kind of activities. In the winter, there's skiing. To the east, we have lots of cultural opportunities in the Washington area, artistic, cultural museums, that kind of thing. So there truly is something for everyone. Matthew, could you speak a little bit to your experience in this area?
Absolutely. I've been living here for about a year now, and there's just so much to do. I mean, DC's right over there. It's about 40-minute drive from the school itself. And like Riley was saying, there's something to do for every type of environment or anything that you would like to do, and less than an hour from the school. So if you want to go hiking, you go west for an hour. If you want to go to the city, you go east for half an hour, right? If you want to visit a whole nother state with its own things, Maryland, you just go north for about half an hour as well. There's a lot of great restaurants. I have a Google Maps full of restaurants that I love eating out here. And DC's great because, you know, all the Smithsonians are free. You get to visit those every once in a while, and it's just a good time. It's a very, very cozy place, very safe, very family friendly for sure.
Well, thanks, Matt. So this is a bit about our accreditation. We are thoroughly accredited by a number of agencies. So first, we are institutionally accredited by SACS, the Southern Association of Colleges and Schools. SACS is recognized as an accrediting agency of colleges and schools by the Department of Education, and DMU has voluntarily participated in the accrediting process. It has met or exceeded all standards and thorough evaluations. It's also been approved by SCHEV, the State Council of Higher Education in Virginia. And the PsyD program has been recognized since 2006 as a National Register Designation Program by the Association of State and Provisional Psychology Boards. The PsyD program has been accredited by the APA, the American Psychological Association, since 2016, and that's a very important accreditation aspect. And then the Divine Mercy University has been approved to participate in the National Council for State Authorization Reciprocity Agreements. So as you can see, we are thoroughly accredited by a number of different accrediting agencies, including the APA. Okay, so clinical psychology is the psychological specialty that provides continuing and comprehensive mental and behavioral health care for individuals and families, consultation to agencies and communities, training, education, and supervision, and research-based practice. So this slide indicates it's sort of an outline, you might say, of the structure of our program. It's 122 credit hours, which includes a master's of psychology en route to the doctor of psychology. And what that means is after the first 2 years of study, after 60 credits have been completed, students are awarded a master's of psychology degree en route to the doctorate. And it's after the first years, it's 3 years thereafter for a total of 5 years for the doctorate. And it is on site, as we've said, in Sterling, Virginia. And this does prepare ultimately for licensure as a clinical psychologist. Now, in the first year, students will have classes and they begin dissertation research. And then in the second year, classes continue, but this is where the clinical externship begins. And so that's an on-campus clinical supervision. So in other words, students they'll have a faculty supervisor, and so their interactions with patients will be supervised and scrutinized by faculty members. But in year 2, there's still coursework, and in year 3 and 4, there's also coursework, but it's somewhat less, and there's more clinical hours. And then in year 5, that's when students go off campus to a internship off campus where they go through more clinical training, and there's no classes at that period. And then usually between years 4 and 5, there's they defend their dissertation. So that's towards the end of the program. And then but in the 5th year, the internship off campus, our students, we have 100% placement into APA accredited sites, which have included things like St. Elizabeth's Hospital in DC, the Psychiatric Hospital of Washington, and the Virginia Medical Center. Matthew, can you speak a little bit more to this structure and your experience with it?
Sure. So like you were saying, Bradley, during year 1, it's all class loads throughout the semester. So you'll have about 5 or 6 classes per semester for the first 2 semesters. Between 1 and 2, you'll also be expected to attend a summer semester, which only has 2 or 3 classes during that time. And it typically goes for a month and a half. As the years go on, the classes reduce in size and the time at externship increases in size. So this graph is a little misleading, as year 2 will still have about 5 courses per semester, along with 1 or 2 clients you might see at the IPS center. And then year 3, which is the year I'm in right now, I only have about 3 or 4 classes per semester, and I'll be spending about 2 or 3 days seeing about 8 to 10 clients per semester. By year 4, that reduces to 1 day a week of classes, and then the rest of the week is externship. And then by year 5, there's no classes, like it says right there, and you're only doing basically just work, working with clients and finishing up your dissertation if need be. I'm trying to finish up by the end of year 4, though. So pray for me.
No, sure. Yeah. Well, I hope you do just that. Thanks, Matthew. That's quite helpful. All right. So things to consider: is the PsyD program right for you? Do you want to help people flourish while you're interested in the science behind human behavior? Do you want to become an instrument of healing through the psychological sciences? Are you interested in performing psychological tests and assessments to diagnose your clients and create treatment plans? Are you looking to start a career as a licensed mental health professional, but specifically as a clinical psychologist? So, questions to think about as you discern. All right, so these are the chief areas of competency that we aim to achieve through the PsyD program, and there are 6 of them. So foundations in psychological sciences and research, integrity in practice, assessment and diagnosis, therapeutic intervention, professional roles, and clinical practice from a Catholic and integrative perspective. And so the first 5 are standard in PsyD programs, but at Divine Mercy, we have this 6th, this clinical practice from a Catholic perspective, really kind of is our, our trademark in a way. It orders and sort of directs you might say, the rest of the program toward, understanding the human person and the image of God and that kind of thing. All right, so let's take a look at each one of these goals in particular. So the first one, foundations in psychological science and research. Graduates will attain foundational psychological science knowledge of biological, cognitive, affective, social, and developmental aspects of the human person, as well as history and systems of psychology, psychological measurement, research design, and statistical method. Graduates will have the skills necessary to conduct their own psychological research. 2, integrity in practice. Graduates will be knowledgeable in the areas of diversity and ethics and display critical thinking, self-aware and reflective practice, and self-care. Graduates will demonstrate responsiveness to supervision, collegiality, and professional comportment in professional practice. 3, assessment and diagnosis. Graduates will be able to conduct clinical interviewing, perform intake evaluation, demonstrate knowledge in the administration, scoring, and interpretation of psychological assessment, integrate multiple sources of test data and clinical interview information into a written report, diagnose and develop a treatment plan. And 4, therapeutic intervention. Graduates will be able to demonstrate case conceptualization, treatment planning, building and maintaining a therapeutic relationship, psychotherapy skills, crisis management of urgent and special circumstances, and discharge planning. 5, professional roles. Graduates will be able to function in a variety of required roles of professional psychologists to include consultant, educator, supervisor, practice manager, and program evaluator. They'll be able to work collaboratively within interdisciplinary teams and with clients. 6, clinical practice from a Catholic integrative perspective. Graduates will have developed a Catholic understanding of human flourishing and the individual person in marriage and family life, and be able to integrate this with the psychological sciences in clinical practice. All right, so these are some sample employment tracks. There are many, many things you can do with a doctorate in clinical psychology, but these are just a few of them. So obviously being a licensed clinical psychologist, but also being a clinic director, a psychiatric technician, a psychiatric crisis unit interviewer, a community health, mental health social worker, drug abuse social worker, certified alcohol or drug counselors, therapists. So there's, as you can see, there's many others. And really, one of the strengths, I would say, of our program, it is a general program in psychology. So you'll be able to find the areas within psychology that you think are most interesting and go into those things. We'll have graduates that will be in hospitals, that will have practices and clinics of their own. Some will decide to work with other mental health workers, such as social workers or counselors. Others will end up working with psychiatrists and hospitals. So there really is a plethora of things that one can do with clinical psychology. All right, so these are a few testimonials from our alumni. James Walovich has said, in our clinical psychology program, the training is focused on healing the whole person. Kristen Long has said, I was drawn to the PsyD program, a desire to help to serve others in a more profound way than my previous positions offered. Timothy White, this school is not afraid to teach you what it means to be human at every level, psychologically, philosophically, and theologically, and that's why I like it. Then Kirsten Curtis has said, I am so thankful for DMU. The faculty members are very supportive and I receive a lot of hands-on clinical experience. So lots of happy alumni. Okay, this is a short YouTube video of one of our alumni, William Johnson, who has carried out research on PTSD.
Hi, my name is William Johnston, and I'm a PsyD student at Divine Mercy University, currently approaching the end of my third year in the program. Military service runs in my family, and so both my grandparents served, my parents both served. This door, the PsyD program at Divine Mercy University, opened that opportunity for me to continue to get back, to conduct research and hopefully implement a more robust program to treat PTSD as it relates to combat veterans. DMU has certainly provided the integration that I've sought in terms of my formation, both the philosophy and theology core, in addition to the psychology curriculum, has provided me growth in terms of my faith and my role as a husband and father, and of course a psychological clinician. So in essence, the Catholic Christian meta model of the human person is why I'm here, both for my own sake as well as the sake of my future clients.
Okay, and then we have another video from another alumni giving her testimony of DMU.
I would say that being a student at Divine Mercy University, or DMU, is one of the best things that happens to me. I really appreciate a great support from faculty members and also classmates. I have gained a great deal of knowledge in all aspects of clinical practice, research, and also professional development. DMU not only provides students with strong academic skills, but also prepares them for a career in psychology. I personally benefit from mentorship with academic advisor and clinical supervisors. As a person, what I most appreciate from DMU is that its mission helps broaden my perspectives in understanding a human person through the lens of Catholicism. Catholic principles, especially in hope, love, and faith, are very valuable and certainly help me become a better clinician.
Okay, with that, let's move on to our faculty. So this is a selection of our many faculty members. So in the top left, we have Dr. Lisa Klowicki, who is our PsyD program director. She is a specialist in adult, adolescent, and couples therapy. To her right is Dr. Diane Graves, who's the assistant program director, and she is a specialist in child and developmental psychology. And to her right, Dr. Anna Pecoraro specializes in addiction and trauma. And the three gentlemen on the bottom are among the founding faculty members of Divine Mercy, formerly IPS. So Dr. Scarfani is a specialist in cognitive behavioral therapy and group therapy. Dr. Nordling specializes in child, marriage, and family therapy. And Dr. Vitz, the senior scholar and professor, is a specialist on the integration between Christian theology and psychology. So we have, this is just a sampling of many other faculty members that have specialties and expertise amongst practically every single major field within psychology. So really, you're in good hands with our faculty. Okay, this is a bit about licensing. So is licensing required? A license to practice is required by each state and/or jurisdiction where individuals might practice as a counselor. When licensing process begins after the student completes the practicum and internship and officially graduates from DMU, states can and often do have additional and differing requirements. Students are responsible for checking state requirements where they plan to work and adhere to them. And these typically include national and state exams. And DMU will provide general information related to licensure during the student experience. So who initiates licensing? Licensing is a student-driven process, and it's important for the student to begin research or licensure requirements in the state he or she intends to work in as early in the program as possible. Will the students be fully licensed after graduation? No. Students must work approximately 1 year in a supervised clinical environment in addition to other state requirements to be licensed. And the graduate may be required to obtain a provisional license for this year period. And be sure to check your state for requirements. Matthew, is there something that you wanted to add to this?
I know this is a lot of information for one slide. And a lot of this happens after you graduate, after you get your degree, and you have a couple hundred hours of face-to-face hours on your belt. You'll go back to your state individually, wherever you want to start practicing, and finish up the rest of the hours, maybe in a postdoc, if that makes sense.
Mhm.
And then finish up kind of like one last big test, and then you'll get your license. A lot of people are confused about what the license even does, or like what it is. And at the end of this program, you don't automatically get a license. Those are given by the state. But this program does prepare you well to receive that as soon as possible after graduation.
Okay, fair enough. Thank you. Okay, so these are two graphs that indicate or show the difference between investments. So on the one hand, something like a car investment, something material, it will often depreciate rapidly after you make that investments. So you drive the car off the lot, and a few years thereafter, it has a lot less value. Whereas when you're investing in your education, in your mind, your investment is going to appreciate, it's going to grow. Your value as a clinical psychologist will grow throughout your career, because you will become an expert. You'll grow in experience and knowledge in a certain area within psychology, and so you'll have more to contribute to whatever field that may be. Okay, this slide is a bit about the financial side of the investment. So it is $1,095 per credit at 122 credits, which is $133,590 in total. And that does not include fees and indirect expenses. As you can see, there are many different options for funding the education, including federal aid, William D. Ford, federal student direct loan program, the Stafford loan, the Graduate Plus loan. And this is important that the financial aid department will work with you. So once you submit your application to the doctoral program, the financial aid department will be in contact with you shortly thereafter and on an individual basis. Also noteworthy is our assistantships. So a number of our students do sort of like work study programs. So they'll come and work for different departments within the university. For example, we have some work study students in our financial aid, the admissions department. And then in the business office, we have other students that are doing the same thing. So there are different ways to, work on a part-time basis on campus. And then there's other alternative financing plans indicated down here, cash plans, private funds, different things of that nature. Also worthy of note is the MOUs. So for those that have connections perhaps, or could establish connections with a diocese, if you're Catholic, you could arrange for the diocese to pay for part of your education, provided that you come back and work for them after graduation. Things like this. So there are different options to explore when funding this kind of investment. But again, the financial department will be in touch with you once you complete the application. These are some of our scholarships on offer, and they range from different amounts, as you can see indicated on the right-hand side, and they apply to different people. So, for example, the Faith and Hope Scholarship is for clergy, or the Christendom Scholarship, as you might surmise, is for Christendom students. But there's really most likely you'll be able to apply to a number of these, and you can apply to a maximum of 4 and receive up to 2. So that's also an option that you should definitely consider. All right, so this is a bit about entrance requirements. So a baccalaureate degree from a regional accredited or internationally recognized school is required, and an undergraduate degree in psychology is preferred. So that means that students without any undergraduate training in psychology will be required to complete a prerequisite course during the first year of the program. That's typically online, and it's concurrent with the other classes that students take during the first year. And then we do require a minimum GPA of 3 on a 4.0 scale. And then applicants with a GPA of less than 3.0 may be considered for application on a case-by-case basis. So if you're really close to that 3.0, go ahead and get in touch with me and we can see what steps can be taken moving forward. Okay, this slide is a bit about the application process. So the first step is to complete the application online. And then 2, our financial aid office, as I mentioned before, will be working with you upon receipt of the application. And then consistent communication is maintained consistently thereafter. And then once the documents of all, that is the documents for the entire application are submitted, the competitive applicants will be invited to interview on the site that is on campus. And then all applicants will hear back the admission decision by mid-February. And the program will begin in August of 2013, so about a year from now. All right, so how to complete your application package. The online application form is the first thing. So the first part is an online app. It's a $55 application fee. And the second are your essays and your resume, which can be submitted later. Moreover, we do require 3 letters of recommendation, 2 of which must be academic in nature. So if you can find faculty members that you've had from undergrad, or if you have a graduate degree, find professors that know you and that can recommend you to doctoral studies in psychology. And then 1 can be less academic in nature and more personal. So for instance, if you know a priest that knows you well, can speak to your personal strengths, that would be a good idea. And then of course, official transcripts from all post-secondary institutions. So, you know, college, and if you went to a graduate program, graduate school as well. And then the official GRE test scores need to be sent to DMU, and there's our code, and they do have to be up to date. So within the past 5 years is required. Okay, this is a bit about information for international students. This doesn't apply to everyone, but for international students, this can be helpful. So for international applicants and applicants whose baccalaureate degree was earned at an institution outside of the US, please keep this in mind. Applicants holding degrees from outside the US must submit an international transcript to an ANASA's approved evaluation service, such as west.org, for a course-by-course evaluation of their transcripts. Applicants holding degrees from outside the United States must demonstrate post-secondary education that is at a minimum equivalent to a US bachelor's degree. And if the credential is not in English, the credential must be translated into English. And the cost for this evaluation will be the responsibility of the student. Applicants whose primary language is not English may also need to take the TOEFL. Okay, so that's all I have for you. At this point, I'm going to stop my share and transfer over to Matthew. He's going to speak a little bit to his own experience getting into psychology and his own experience here at Divine Mercy. So Matthew, the floor is yours.
Great, thanks, Bradley. So, like you guys know, my name is Matthew Nguyen. I am a 3rd year in the PsyD program here at Divine Mercy. So the PsyD program is entirely in person. The first year was kind of hybrid because of COVID and the pandemic. And so I was doing some part-time work and also taking the classes online. So I would have to Zoom in every single day to attend the classes and whatnot. But I finished my 2nd year here in full in person. And then I'm starting my 3rd year. So just a little bit about how I personally got into psychology. I was originally wanting to be a priest, actually. I was in the seminary for a year, and I had taken psychology as an undergrad. And I was at a Catholic school, actually, when St. Martin's University in Lacey, Washington. Doing all of the psychology courses out there really opened my mind to, oh my gosh, like everything that is happening in this somewhat very secular world of the field of psychology is matching up with a lot of my beliefs and my faith and what we understand to be true about the human person. It really intrigued me and really kind of opened my eyes into like, okay, this is a pursuit of truth. This is a pursuit of goodness. And I'm kind of interested in this. I kind of want to look into this more. And how can this be used to serve people on a real level, on a genuine, loving, and charitable level? As I spent some time in the seminary and discerned a little bit more, I felt that God was calling me to pursue psychology as a full-time kind of job. And so after discerning out, like Divine Mercy came up, and here I am. And as I'm taking classes and learning just more and more about all the findings within the scientific world of psychology, but at the same time in congruence taking classes of philosophy and theology here, and just integrating this idea that, oh wow, yes, we are mind, body, and soul. Let's not forget about the mind and the body as we focus on the soul, right? And so a lot of great professors, a lot of good things that we're learning here. I've got a lot of great skills under my belt, and I've been seeing clients for about a year now, and going into my second year of seeing clients at my new externship, which is a local mental health clinic in the area. Really excited to get that going and seeing the people in this community here. If you guys have any questions about anything, feel free to reach out to me and Bradley, of course. But it does look like, Bradley, we had a question come up during your presentation, so I'm not sure if you'd like me to answer that now.
Yeah, sure. Let me just read it. So for someone who may not have an undergraduate degree in psychology or counseling, what do you recommend if their interest is in PsyD? So yeah, why don't you go ahead and take that on, Matthew?
Sure. So if you don't have an undergraduate degree in psychology or counseling, like Bradley said, a psychology degree is preferred. However, it's not necessary. There's a lot of my peers and cohorts in the cohort that have a biology degree. They also have a philosophy degree or even a theology degree. And that course at the very beginning of the first year helped them to acclimate to the psychological language and whatnot. But a lot of what I personally covered in undergrad while I was doing a psychology degree is actually reviewed and actually expanded upon within the program itself. So while it is helpful to have a psychology degree, it's definitely not necessary, especially if you're very committed to the academic work and just like that critical thinking, like we've been mentioning before. It's the information is definitely a lot, as it is a doctorate program, but it's not undoable for someone who is open to learn and ready to learn. Absolutely.
Yeah, sounds good. Thanks, Matthew. So could you maybe speak a little bit to, a lot of times people will ask about the difference between counseling and clinical psychology, right? So could you maybe talk a little bit more about that, and what, to your mind, really is what's distinct and sort of, what sets clinical psychology apart from counseling?
Sure, great. I know that we had talked about this before, Bradley, so I'm glad you bring it up now. So there is a very, very fine distinction that may be sometimes blurred, sometimes in people's heads, and the general misconceptions of what each field does. Divine Mercy does offer a counseling degree as well as a clinical psychology degree, so clinical therapy. I would say the major difference is that if you were to pursue the PsyD and the degree in clinical therapy, clinical therapists are able to assess people and make certain diagnoses that a counseling professional might not be able to. We're also able to, during this program, we're equipped with different modes of therapy that addresses more severe kind of cases such as schizophrenia, more severe cases of depression and OCD, things like we'll be able to treat like people with autism or Alzheimer's, depending on what field you specialize in or what population you specialize in. Counseling is similar to clinical therapy. However, a lot of it is, I don't want to say life coaching per se, but in many ways, a lot of the less severe types of depression, anxiety, maybe career issues or discernment. Some counseling degrees also provide you training to do some family therapy, some couples therapy. But on a larger scale, the PsyD is able to do all those things and just a little bit more. That kind of distinguishes them in terms of outreach, in terms of ability, in terms of like a wider kind of umbrella of things that we can do on a deeper level, if that makes sense. If you remember the slides and if you have access to them after this, and go back to all those sample kind of jobs that someone with the PsyD can do, being a clinical director, absolutely, and doing a lot more, like I said, assessment and diagnosis of like those severe diseases of the mind.
Yeah, fantastic. So to these tests that you mentioned, what
Sure.
would be some sort of standard psychological assessments that a clinical psychologist would carry out?
Sure. Yeah. Before I get to that, something I forgot to mention for the PsyD is that we also do research as well. And as we test certain like therapies and whatnot to see which therapies actually work based off of evidence, we call them evidence-based therapies, right? We are able to refine the field more and to participate within the field in a deeper way that maybe even counseling can. You mentioned what a typical assessment might look like. So when someone comes in and they need to be assessed for example, they don't know what's wrong with them, right? Am I depressed? Am I going quote unquote crazy, right? Am I seeing things, whatnot? We have certain measures and assessments that have been found through a lot of evidence and a lot of scientific research that have been found to pinpoint what the issue is, if that makes sense. So if you heard of tests like the MMPI or the MCMI, or if you kind of followed the Johnny Depp Amber Heard trial and listened to all the psychologists present in a forensic and a court environment all these different assessments that they gave to either Amber Heard or Johnny Depp or whatnot, right? These are the assessments that we learn in this program. If you ever heard of the ink block test or different like storytelling tests and whatnot, we were taught all those assessments within the program itself. By the second year, you will have access to and have the tools to even do the IQ test. So I've learned all these things already, and some of my classmates have gone on to externships where they administer these and formulated reports for clients, like complete reports for clients in hospital settings, in private group practice settings, and whatnot.
Very cool. Yeah, I think that's super interesting. So you could also carry out personality tests as well, right?
Yes, absolutely. Yeah.
Yeah. So it seems that the advantage with clinical psychology is that you have a greater tools kit at your disposal, right? So you're able to rule out underlying factors that could show up on a psychological test that maybe a counselor couldn't do. And as you say, you also have extensive clinical training, and you have lots of coursework, lots of heavy duty research into really where each field within psychology rests. Where is what does the evidence show? What are the best practices? That kind of thing. Because in a way, you're a scientist clinician, right? So you're trained to carry out research, but also to digest that research as a practitioner, as a clinician, right?
Yep, absolutely.
Okay. So could you maybe say something about your own, sort of looking for your own career and your own goals and your own future? What do you see? I mean, so you've gone to your sort of immediate race at Divine Mercy. You've had, some years under your belt now. What are you interested in, and what do you see yourself getting into in the future?
Sure. So I actually have a background in working with delinquent adolescents within an inpatient treatment facility in the state of Oregon. Back then, I was just a residential counselor, so I couldn't do much other than just talk to them and like listen to them and just like take care of them, just their bodily needs and whatnot. And as I look forward to the future, I hope to work with them in a clinical sense in that these delinquent adolescents, for example, they suffer a lot of PTSD. They suffer from a lot of family issues and attachment issues and whatnot, and they would receive therapy from the on-site doctorate level clinicians. I saw that and I was like, hey, I want to do that, right? I want to work with these kids and their families on a deeper level to kind of unpack those wounds and hopefully to heal those wounds that have been so buried deep that had led them to commit these crimes, these felonies sometimes, and lead them to a life that isn't fulfilling, to lead them to a life that isn't free. And so as I look forward to the future, I hope to work with that population. They're just very close to my heart. And so looking hopefully to work in maybe even a hospital setting, but definitely maybe also treatment facilities that have these families that need help.
Yeah. So speaking of hospitals, sometimes people so we've talked about the difference between counseling and clinical psychology. How would you distinguish clinical psychology from psychiatry?
That's a good question. So psychiatrists are actually very drastically different from psychologists. Mm-hmm. Psychiatry, you receive your medical doctorate, and psychology and clinical therapy works more through kind of thoughts and behaviors and thinking patterns and whatnot, and trying to get to the root of that through talk therapy or through even working with psychiatrists. Psychiatrists, they do see clients, but their main mode of intervention is through medication. While psychology and clinical therapists, their main mode of intervention is through like their therapeutic orientations, such as like cognitive behavioral therapy or things like acceptance and commitment therapy and whatnot. So psychiatrists, they don't do a lot of the family work. They don't do a lot of the couples work or like intense severe cases outside of medications, while psychologists work with psychiatrists to provide the best form of care, which through evidence we found is a mixture of both medication and therapy, not one or the other. If that makes sense.
Yeah, no, makes great sense. So what have you found to be, maybe speak to the most enjoyable and rewarding parts of the program thus far for you, and the things that have been the most challenging?
Sure, I'll start with the most challenging and end on a good note. Okay. One of the most challenging things I think is I came in with a misconception of like how much commitment this program takes, if that makes sense. My first year, I mentioned before, I was doing some part-time work, and it was very taxing. I was very tired all the time. And once I started to shift my focus and understood, like, no, this is like a job, right? This is like I live and breathe psychology, and I have to, like refocus every single week and every single day to growing myself in a professional manner as a psychologist, but also looking out for those times where I'm like, okay, got to refocus, got to remember what this is all about, right? And the prayer definitely helps. Definitely helps with that. One of the most, I think, well, one of the most important blessings I've had throughout this program has just been this. It's been a joy working with clients and talking with my cohort and just growing in community with them as well. I have a priest in my cohort, and the first cohort also has another priest, and we also have sisters in our program as well. And just speaking with them and just seeing how they love and seeing how they live such a pious life and a zealous life within a field that on the outside looks like it's very secular in nature. A lot of people think that psychology kind of detracts from the soul, kind of detracts from the pursuit of God. Like, well, no, it's actually quite the opposite. As we enter in these people's lives, we help them to untangle kind of life's mess, if that makes sense,
Sure.
and to see them be free to pursue God in a way that is genuine, right? In a way that they can make that decision themselves and make that choice to like, okay, this is where I'm at in my life. It's just been a joy, to be able to be part of that process, and to be able to walk with people, if that makes sense.
Oh, that's beautiful.
Dr. Vitz, one of the founding guys of this program, he speaks about he hopes that John the Baptist one day is the patron saint of psychology, as he sees psychology as John the Baptist did, paving the way and readying the way for the Lord, right?
That's beautiful. Thanks for sharing that. What would you say is really the greatest strength of Divine Mercy? Now, I know maybe that's not a fair question because, you've only been to Divine Mercy and not other schools of psychology, but if you
Sure.
had to kind of, for people that are, listening to this and wondering, like, what is it that's really remarkable and salient about Divine Mercy? What would you say?
Sure. I think in comparison to other schools, again, never been at another school besides Divine Mercy,
Sure.
because I love it here. But it does a fantastic job of helping you to understand the fullness of the human person. And that includes yourself and myself. This idea that you can pray things away, or this idea that depression is just sadness, or can just be fixed with talk therapy. Like, no, it's a little bit of everything, right? And while some programs, they lean very heavily into CBT or very heavily into the research and whatnot, that's all well and good, but to forget the meaning and the purpose behind what we do, I think leads many people astray, which is why even within the field of psychology itself, there's a lot of different divisions, there's a lot of different perspectives and philosophies that may be harmful to clients, that may be harmful to patients. And so as we approach this view of the human person as full of dignity, as full of worth, as full of this value that deserves unconditional love, and our very best research, our very best therapy, and our very best practice, it just provides this whole deeper meaning of what it means to be a therapist. And part of that, and we discussed this in class just the other day, means to work on yourself and to look back on yourself and say, okay, if I'm going to be here helping this person to be free, I need to find those places in my heart that I'm hurt. I need to find those places in my life where I'm not free, where I'm a slave to some things, where I am struggling, right? Because if I don't know the way, then how can I guide someone else down that way?
Yeah, No, it makes perfect sense. Hard to argue with that. One last thing. So,
Sure.
has there been, I think maybe another thing maybe that I would add on to that is, we really are a generalist program, right? So, you're exposed to basically every major school of psychotherapy. You're well exposed to all of the different treatments and testing and research, right? What has been maybe a school of psychotherapy or a thinker that has been, you've been exposed to at Divine Mercy maybe for the first time that has really changed the way that you thought about the human person and your role as a future mental health clinician?
Sure. Yeah. No, that's a great question. And so you're right. We are a generalist institution, which means that we explore kind of the fullness of the field, which means that we don't really narrow in on kind of one thing or another. But this idea of there's a psychologist named Erickson, and this might be Psych 101 for some people, but Erickson laid out human development on a couple stages, and he said that there's a struggle between each stage. And just in my experience of people and just speaking with them and just listening to their struggles and their sufferings and whatnot, these ring very true. For example, for adolescents, the population I want to work with, Erickson says that during this stage of adolescence, the struggle that's pulling them and causing this tension within them is that they either find their identity or it leads them to identity confusion, right? Within the school, and Erickson mentions it, and within a secular school, they don't really mention this last part, but Erickson tied a virtue to each of these things, right? To each of these struggles, that will help to guide them through each of the struggles. So another example for the elderly, the geriatric community, right? The geriatric population. Either that they're struggling between finding themselves with full of integrity, which means that their dignity is still in worth, or like decay, if that makes sense. And so like, okay, am I worth something in my old age, or am I just going to pass away without being helpful or useful anymore, right? And it opened up a whole new way of thinking about helping people and what their core struggles are, and what their main hurts are. And so it's helped me to grow in empathy for sure, and compassion for each population and every client that I see.
Yeah, excellent. Thank you, Matthew. And thank you for your time. With that, I'm going to wrap it up here.
Sure.
For those of you who are watching, if you are interested in our PsyD program, I have listed my email address, my Calendly link, and the application link in the chat. So be sure to take advantage of that. And again, I want to thank Matthew very much for your time and sharing us all of your knowledge about this program, which I think is a truly wonderful one. So with that, thank you and God bless you.
Thank you all. Thanks, Bradley.
Bye-bye.
Take care, everyone.